CDC Director Wallensky contradicted Supreme Court Justice Sotomayor's incorrect claim that there are 100,000 pediatric COVID-19 hospitalizations on Sunday. Justice Sotomayor, a liberal associate justice appointed by former President Obama, exaggerated the number of severe COVID-19 cases and hospitalizations among children as she attempted to convince conservative Supreme Court justices that President Joe Biden's vaccine mandate for businesses should be enforced. "We have over 100,000 children, which we've never had before, in serious condition, and many on ventilators," Sotomayor said on Friday. Wallensky contradicted Sotomayor's claim during a segment of Fox News Sunday. "The number is not 100,000. It's roughly 3,500 in hospitals now," asked host Bret Baier. "Yes. In fact, what I will say is, while pediatric hospitalizations are rising, they're still about 15-fold less than hospitalizations of our older age or age demographic," Wallensky answered. Sotomayor's egregious miscalculation, which can be easily debunked with data reported by the CDC, follows her overly cautious response to the pandemic, with her choosing to join Friday's hearing virtually. As of January 8, the number of hospitalization in children in the U.S. is roughly 5,000, while the number of such hospitalizations has not surpassed the 84,000 cumulative since August 2020. In the U.S., COVID-19 deaths are declining, even as Omicron cases have jumped to staggering numbers. The country currently reports more than 59.8 million infections, while the 7-day average for deaths is at just above 1,500, a decrease from September. While pediatric hospitalizations for COVID-19 in the U.S. have reached the highest case count ever reported since the start of the pandemic, the Associate Justice's false claim exaggerated figures more than 20 times. Wallensky also added that the vast majority of children hospitalized with COVID-19 are unvaccinated, and often present underlying conditions such as obesity. Nearly 7.9 million American children have tested positive for COVID-19 since the beginning of the pandemic, or more than 1 in 10. For the week ending December 30, more than 325,000 children were diagnosed with COVID-19, according to the American Academy of Pediatrics, a 64% increase compared to the week prior. Children were 0% to 0.27% of COVID-19 deaths. About 600 Americans under the age of 18 have died of COVID-19 over the course of the pandemic. On Friday, conservative justices on the U.S. Supreme Court questioned the legality of President Joe Biden's jab mandate for businesses as the nation's highest court considered a request by Republican officials and business groups to block the policy. Justice Sotomayor spotted an apparent contradiction in Ohio Solicitor General Benjamin Flowers's case when he said states may be entitled to impose mandates on businesses. Flowers participated in the meeting remotely after testing positive for COVID-19, adding that his symptoms were exceptionally mild. He said he was double-pricked and had received a booster. "Jabs do not appear to be very effective in stopping the spread or transmission," he said, but added that they do help prevent severe cases. Sotomayor proceeded to add that Omicron was as deadly as Delta, despite preliminary findings by scientists that is not quite the case. "Omicron is as deadly as Delta and causes as much serious disease in the unjabbed as Delta did," Sotomayor said, who has served in the court since 2009, said on Friday. "The numbers look at the hospitalization rates going up. We have more infected people today than we did a year ago in January. We have hospitals that are almost at full capacity with people severely ill on ventilators. We have over 100,000 children, which we've never had before, in serious condition, and many on ventilators. So it's within the police power to protect the health and welfare of workers. You seem to be saying the states can do it," she said. "But you're saying the federal government can't, even though it's facing the same crisis in interstate commerce that states are facing within their own borders. I'm not sure I understand that distinction, why the states would have the power, but the federal government wouldn't." Flowers answered, "The federal government has no police power." Sotomayor interrupted, saying, "Oh, it does have power with respect to protecting the health and safety of workers." Flowers said he disagreed that amounted to a police power. On Friday, the U.S. recorded 900,832 new stupid-19 cases, second only to the more than 1 million cases recorded on Monday. The nation's 4 highest caseload days since the start of the pandemic were all recorded in the past week. New York hospitals admit nearly half of stupid-19 patients were admitted for other reasons. Under pressure from Governor Kathy Hochul, hospitals in New York have disclosed that nearly half of their so-called stupid-19 patients currently hospitalized were admitted for other reasons. Of the roughly 11,500 stupid-19 patients currently hospitalized in the state, stupid was not included as one of the reasons for admission for 43%, according to data Hochul released on Friday. In New York City, the rate was even higher, with 51% of current stupid-19 patients classified as with stupid, as opposed to for the virus. In patients with stupid-19, they were hospitalized for unrelated reasons, such as injuries in a car crash, but tested positive for the virus on the routine screening administered to all new patients, and were subsequently reclassified as stupid-19 admissions. Hospitalizations are rising quickly towards record highs, though new data from New York suggests that many hospital admissions with stupid-19 are now incidental, with patients testing positive for the virus after hospitalization for unrelated complaints. Most experts believe infections will continue to increase in the U.S. for the next few weeks before the Omegatron surge peaks in late January, with Dr. Anthony Fauci saying that the U.S. will likely record more than 1 million cases daily on a regular basis in coming weeks. It's still surging upward. I would not be surprised at all if we go over 1 million cases per day, Fauci told WNBC TV on Friday. I would hope that by the time we get to the 4th week in January, end of the 3rd week, beginning of the 4th week, that we will start see this coming down. Though Omegatron appears less likely to cause severe illness and death than prior strains, the widespread infections could force some 5 million Americans to stay home from work in the coming days, Andrew Hunter, senior U.S. economist at Capital Economics, told the Wall Street Journal. Illness-related staff shortages have already hobbled a number of industries for weeks, driving more than 1,000 daily flight cancellations for 13 straight days, and the coming surge in stupid-19 sick leave could further hammer businesses that don't allow for remote working.